we will be covering on the pathology section, pathology and laboratory section, and we are having our first scenario here. And I would like to invite Miss Anu. Miss Anu, can you please read this scenario for me?
Yeah, thank you, Miss Sandeep. Mm, A 87641, A 49.02, answer B 87640, A 49.02, and C 87651, A 49.02, and the D is 87652, A 49.02. ROMRSA, central line catheter. Method, single nucleic acid sequence. Culture, methicillin resistant Staphylococcus aureus MRSA isolated. What are the CPT and ICD-10 CM codes reported? Clinical indications. Patient with fever not responsive to antibiotics. Collected 03/30 and the time is 1745. Assessment num TXXX. Status anticipated. Sorry. Codus. Here your time starts now.
So the keywords would be central line catheter. Method used is a single nucleic acid sequence, and the culture was positive for methicillin resistant Staphylococcus aureus. And we are having clinical indication the patient was with fever and not responsive to the antibiotics. So what I said, this is a pretty straightforward answer. The correct answer is option A, 87641. It is coding for all the keywords which we are having. We are having a Staphylococcus MRSA positive. We are having Staphylococcus. Here we go. It is methicillin resistant. And the technique which is used is amplified probe technique. And the parenthesis you can see for assays that detects methicillin resistant and identify the Staphylococcus aureus using a single nucleic acid sequence, user code 87641. So single nucleic acid is the technique which is used. You can see here, method use is single nucleic acid sequence. So this covers all the keywords which we are having. And the correct answer is 87641. Let's look into the other options as well. 87640, it is coding for Staphylococcus amplified probe technique. It is just coding for a Staphylococcus. It is not coding for methicillin resistant Staphylococcus. So that's a wrong one. Next one, 87651, which is coding for Streptococcus group A. It is not even coding for a Staphylococcus. This is coding for a Streptococcus group A, which is not our culture. So that's wrong one. And option D, 652, that is also coding for a Streptococcus group A, which is not our culture. So that eliminates option D as well. Did that explanation worked? How are you feeling, coders? Let's make this session more interactive. After all, this is a group study. How are you feeling? Good, good, good. Yes, coders. Let's be more interactive in this session. Let's have fun. And correct answer, answer A. Now let's move on to the next scenario, case 2 scenario. And I've got Miss Eva. Is that you coming up for this scenario?
Yes, that will be me.
Thank you, Miss Eva. And thank you, Miss Anu, for reading that scenario once again.
Okay, coders, what are the CPT and ICD-10-CM codes reported? A. 88321C01, B. 88325 C01, C. 88329 C01, D. 88323 C01. Case 2, requesting provider CIMD. Surgical pathology report collected. Received 3/4 of the present year. The pathologist providing the service is an employee of the lab. Materials received for consultation. 3 referred specimens described as left base of tongue, left tonsil, and right tonsil. Clinical data slides are prepared and reviewed in conjunction with the patient being seen for radiation oncology consultation for carcinoma of base of tongue. Final diagnosis, 8 slides prepared and review A through H, left base of tongue, part A, and right tonsil biopsies, part B, C, G. Squamous mucosa and tonsillar tissue, no carcinoma identified. Left tonsil biopsies, parts D, E, F, H, tonsillar tissue with no carcinoma identified. What are the CPT and ICD-10-CM codes reported? Coders, you have a minute and a half.
Great work, coders. I think that's around 2 minutes. Thank you, Miss Eva. And good work, coders. Yes, I can see a lot of correct answers. There are a few wrong answers as well. But it doesn't matter as long as you are learning. These are teachable moments. It is considered to be as gold, as what Mrs. J says. So keep putting your efforts and keep learning. So let's have the keywords, highlighted keywords. You can see the employee of it, the service is provided by the employee of the lab. It is a consultation, and the referred samples are left base of the tongue, left tonsils, right tonsils. The slides are prepared and reviewed. The carcinoma of base of tongue. The final diagnosis, we are having 8 slides prepared and reviewed from A to H. Left base of the tongue, right tonsils, biopsies, squamous mucosa, tonsillar tissue, and there's no carcinoma identified. Left tonsils, biopsies, tonsillar tissues, also with no carcinoma identified. And the correct answer for this is option D. And let's see how we arrive the answer. These are our code options. And let's look into the first one. 88, I'm sorry, 88321. Let's see what they're coding for. It is coding for consultation and report on the referred slides prepared elsewhere. So as its term says, it is for the slides that is prepared elsewhere. But we are having the slides which is prepared here itself in our laboratory. So this is not prepared. The slides are not prepared outside. So that eliminates option A. It goes away. And let's look into the next one. It is 88329. 88329 is coding for pathology consultation during the surgery. So 88239 is more a kind of an intraoperative pathology examination. So this will be done mostly during the course of a surgery. And in our scenario, it was not done during the course of a surgery. The patient is being seen for a radiology, oncology, radiation oncology consultation. This was not during the surgery. That eliminates option C as well. And let's have a look into next one, option B, 88325. Well, the 88325 is coding for a consultation comprehensive. Comprehensive is a keyword there, with a review of records and the specimen with report on the referred materials. We didn't had a comprehensive consultation in our scenario. This was not a comprehensive consultation, and neither there were a review of the records and the specimen as well. So in 88325, actually, there will be a comprehensive consultation with a written report of the consultation, which describes a review of the records, evaluation of the specimen, and it might include a complex slide preparation as well. And it was not performed. It was not done in our scenario. The correct answer for this one will be 88323. Let's look into 88323, which is consultation and report on the referred materials. We had a report on the referred material, and finally it was said like there was no carcinoma like identified in both the cases here, and it requires a preparation of the slide. As you've seen, the slides were prepared as well. So the correct answer is option D, 88323 C01. So that's all about the pathology section. Coders, if you're having any doubts on this scenario, please put in the chats as I said. Meanwhile, let's move on to the next one, medicine section. So who are we having for the medicine section? Miss Eva, is that you again?
Yes, Mr. Sandeep, I'll do it.
Okay, thank you.
Okay. Coders, what are the CPT and ICD-10 codes reported? A. 95783 G4733. B. 95808 G47.33. C. 95811 RO6.81. D. 95800 G47.33. Pre-procedure diagnosis sleep apnea. Post-procedure diagnosis obstructive sleep apnea. Procedure overnight sleep study. The 35-year-old patient in a hospital sleep lab for attended overnight polysomnogram. Patient oriented to room and changed into overnight clothing and brought into lab by patient. Latency to sleep onset slightly prolonged at 32.3 minutes. During the first 82 minutes of sleep, 80 obstructed apneas were manifested. The lowest SpO2 during the non-supplemented sleep period was 73%. CPAP was then applied at 7 centimeters H2 and sequentially titrated to a final procedure of 18 centimeters H2O. The apnea-hypopnea index AHI changed from 60 events per hour to 4 events per hour. SpO2 increased to 90%. The sleep study with and without CPAP shows severe obstructive sleep apnea with improvement with CPAP settings at 18 centimeters H2O. Based on the improved SpO2 levels with CPAP, it is recommended this patient use a BiPAP machine during sleep hours due to obstructive sleep apnea events. What are the CPT and ICD-10 codes reported? Coders, you have 2 minutes.
Oh, I'm sorry, that's more than 2 minutes, and you guys are doing an amazing job, coders. All are like awesome medicine coders. Okay, thank you, Miss Eva, once again for reading the scenario for me. And coders, let's have our keywords highlighted. You have the post-procedure diagnosis, and that was obstructive sleep apnea. I'm sorry. That was obstructive sleep apnea. You can see the pre-procedure diagnosis was just sleep apnea, and towards the post-procedure after that, it was changed to obstructive sleep apnea. So always have an eye on the post-procedure diagnosis. And the procedure performed is a overnight sleep study. It is an attended overnight polysomnogram, and latency to sleep was slightly prolonged at 32.3 minutes. During the first 82 minutes, there were around 80 obstructive apneas. The lowest SpO2 was 73%. The CPAP was then applied at 5 centimeter H2. and finally sequentially titrated to final pressure of 18 centimeter H2O. And the sleep study with and without CPAP shows severe obstructive sleep apnea. The correct answer to this is option D. I could see a lot of, most of them, around 99% of the coders selected option D as well. And coders, let me show another example of churning, which helped me solve the scenario. Before that, let me tell you what a sleep study is, or a polysomnogram is all about. Polysomnography is all about. The polysomnography is a classification of a sleep study. So the polysomnography actually records various parameters of our human body, such as brain waves, oxygen in our blood, heart rate, breathing, etc., while we are sleeping. It will also measure things such as eye and leg movement, even eye and leg movement. So they will also use something like a CPAP treatment and BiPAP treatment, in order to keep our airway like from collapsing. If you're having some diseases such as obstructive sleep apnea, as in this scenario, and they will see which treatment, whether it's a CPAP or it's a BiPAP, that will suit the patient well, that will address the issue well. So that's what sleep studies or polysomnogram is all about. And for coding a portion of this particular section for the sleep studies, the codes are actually classified mainly based on one thing, that is the parameters measured during the sleep. As I said, during the sleep they will be measuring a number of parameters like oxygen level, the heart rate, etc. So based on number of parameters measured, they will be these codes are classified. Another thing is that they are classified also on the basis of the age of the patient. As you can see, it will be classified. You will be seeing if when I go and explain further, you will be see that the codes are classified whether it's age 6 or below or 6 and above on the basis of age, and whether we are using any treatment methods like CPAP or BiPAP for the for diagnosing the patient. So on basis of these three parameters, these codes are classified. And let's look and see how I chunked the section. This will help you a lot. So you can see 95800, it is coding for just sleep study. Just it's a sleep study and it will be an unattended one. There will be no medical staff or trained skilled professionals around you while you are sleeping. It will be unattended. And the code 95808, this is coding for any age, but it will be just measuring 1 to 3 parameters. And 95810, this is for age 6 and over. So it will be only for age 6 years or older, and it will be measuring 4 parameters, and there will be no treatment methods like CPAP or BiPAP in this. They will be just measuring 4 additional parameters. And 95811, this is coding for age 6 and over once again, and this will be also measuring 4 additional parameters, but it will be having a CPAP or BiPAP machine which is used. I mean CPAP or BiPAP treatment therapy which is used, therapy that will be used. And next one, 95782, this is coding for age younger than 6 with 4 additional parameters without any therapies like CPAP or BiPAP. And finally, 95783, which will be coding for age younger than 6, that will be having 4 additional parameters measured with CPAP or BiPAP machine. Are you following, coders? It is very important. Are you following this the way I chunked this one? Yes. Okay, thank you. And let's solve the scenario. Let's go ahead and solve the scenario. Let's look into the option D, 95800. As I said, that is coding for sleep study unattended. It is just sleep study. Let's cross check with the procedure inventory which we are having. In the procedure inventory, we are having a sleep study which is specifically polysomnogram, and it is attended. It is not. This was not an unattended one. This is attended one. So that eliminates option D. Let's look into the next option, 95783. Let's see what they are coding for. 95783. It is coding for younger than 6. First itself, let me look in the chart portion. It is stating that younger than 6, and age of the patient is 35-year old. So straight away I can say that's a wrong answer. I don't need to go ahead and read the rest of the portion. That's the wrong answer. Let's look in the next one, 95811. What is that coding for? It is coding for age 6 and over. Well, that portion is correct. And it is measuring 4 additional parameters with a CPAP or BiPAP machine. And how many parameters was measured in our scenario? There was just one parameter, SpO2. Only SpO2 was measured in our scenario. Even though CPAP and a CPAP machine was used, therapy was used, there was just one parameter. So parameters plays a significant role in picking the correct answer. So that way, option C is the wrong one. And the correct answer, as most of you have said, is option B, 95808. Let's look what it is coding for. Polysomnography, any age. So this is coding for all the age, and only one criteria it needs is that just 1 to 3 parameters. So if you're having 1 to 3 parameters, as in our scenario, it has measured only SpO2. The correct answer will be 95808. And in this, actually, it is included, whether if you're using the CPAP or BiPAP, whether you're not using it, is included. Only thing is that we just need 1 to 3 parameters. So going ahead, if you see anything like only just 1 to 3 parameters was measured at any age, this is the code. 95808 is the code to be coded. So the correct answer is 95808G47.33, which is coding for obstructive sleep apnea. How are you feeling, coders, on this? What are the parameters we are talking about? The parameters such as SpO2. As I said, during the sleep, several number of parameters will be measured. So based on those parameters, the sleep studies are coded. So see, looking into the chart, if you are having this chart, I don't need to read all these go during the exam. Just looking to those short chart things which I have done, I can easily pick up the answers. That saves me a huge amount of time. And as you know, during the exam, we've got just 1.5 minutes around to solve the scenario. So that will be very crucial. That's why we say here at AMCI, Chan is life. Okay, let's move on. Let me have a look into the time. Let's move on and have a next scenario. Miss Siva, would you do the honors once again for me?
Sure, but I believe this is Miss Carla.
Okay, I'm sorry. Miss Carla, stage is all yours.
Okay, answer A, 95810 modifier 52, G47.30. Answer B, 95811, G47.30. C, 95783, G47.30. D, 95810, G47.30. Pre-procedure diagnosis, excessive daytime sleepiness, snoring, Epworth score 18. Post-procedure diagnosis, sleep study. Procedure, polysomnogram, attended. This 25-year-old patient underwent overnight polysomnogram with the recording of EEG, EOG, submental and anterior tibialis, EMG, respiratory effort, nasal and oral airflow, EKG, continuous pulse oximetry. Total time in bed of 386 minutes and a total time of sleep time of 221 minutes. The sleep latency was 24 minutes and the REM sleep latency was 18 minutes. Throughout the night, the patient had a total of 256 episodes of arousal and 6 awakening. Sleep efficiency was 56%. No apparent Parasomnia noted. The average oxygen saturated was reported to be 95%, with the lowest saturation being 84%. There were no periodic leg movements of an index of zero point 0 and cardiac arrhythmias, arrhythmias were not present. Impression, mild sleep apnea. All right, coders, you have 2 minutes. Let's get it. Let's code.
That's time, coders. That's around 2 minutes. And if you still are working on, please go ahead and put your answers in the chats. So let's get this one done. The highlighted keywords for this is uh, pre-procedure, post-procedure. I'm sorry, we are only having pre-procedure diagnosis here. The patient came for an excessive daytime sleepiness, snoring. The procedure performed is a polysomnogram. This is an overnight polysomnograph done, and we are having EEG, EOG, submental and anterior tibialis, EMG, respiratory effort, nasal and oral airflow, EKG, continuous pulse oximetry. Uh, These are the parameters measured. Total time in bed was 386 minutes, and the final impression was mild sleep apnea. So our final diagnosis is mild sleep apnea. That will be the principal diagnosis. Now let's go ahead. These are the procedure inventory. We are having a sleep study. Once again, this is a polysomnogram, and this is attended, and the age of the patient is 25-year-old. And the total sleep time was, I think, total time in the bed was 386 minutes. And these are the parameters. We are having 7 parameters which is measured in this scenario. And the diagnosis part, we are having obstructive sleep apnea. These are our code options. Okay, these are our code options. And as I done in the previous scenario, I've also done chunning, and this will make my life easier to solve this scenario. 95783. Well, let's see what it is coding for. 95783. This is coding for younger than 6 year, younger than 6 years, with 4 additional parameters with CPAP or BiPAP. Age of the patient is 25-year-old. Once again, let's cancel option C. Let's look into the option B, 95811, and it is coding for age 6 and over with 4 additional parameters with CPAP or a BiPAP machine? Well, the first portion is correct. Age is 6 and over. And the four additional parameters, we are having 4 plus parameters measured. But the tricky part is here with CPAP or BiPAP machine. Were we having any CPAP or BiPAP? No, we didn't have them. That's why option B is incorrect. And let's go to next one, 95810. The option A and D is having the same CPT, 95810. So the CPT portion is correct. Let's see what's 95810. 95810 is coding for polysomnogram, age 6 and over, with the 4 additional parameters without any CPAP or BiPAP machine. So this doesn't have CPAP or BiPAP machine, and this perfectly matches our procedure inventory. The only difference is a modifier 52. So this is purely instruction, like informational for your information alone. You can see under the sleep medicine section, it is reported that report with a modifier 52 if less than 6 hours of recording for the codes of 95800, 95801, 95806, 807, 810, and 811. So it is stating us, it is directing us to use a modifier 52 if the total sleep time was less than 6 hours. And coders, what was our sleep time? It was 386 minutes, which is more than 6 hours of the sleep. So I want you all to give some emphasis on these guidelines. In medicine section, it's a long chapter, as you all know, and they have got several guidelines, so they will be mentioned under each section. So just have go through those sections, have them underline, have them chant, so you can save time as well as you can come to the correct answer during the exams. It is not possible for you to go through those guidelines during the 1.5 minutes which you get. So if you have them underlined, if you have them highlighted, if you have them chant, that is going to be key. So that is the way I eliminated option A. The correct answer is option D, 95810. So coders, was that a teachable moment? How do you feel about that? Did you all go saw that guideline in which I showed there? How many of you have seen that? No. Yes. So there was a guideline over there. That's why I wanted to bring it up and show you. So just go through those guidelines in the chapter medicine section. We have got 2 minutes more and we have one more scenarios to cover from the medicine section. Do you want it covered, coders? This is a good one, let me say. Do you want to cover that one? It's all up to you. Let's go. That's the spirit. Okay. Let's do it, coders. So this is the last scenario for the day. Miss Eva, who do we have for this one?
I'll do it, Mr. Sandeep. I don't think we
Okay.
had it, so I'll go ahead. Um, what are the CPT and ICD-10 CM codes reported? A. 95971, Z4542, G40.0909. B. 95972, Z45.42, G40.909. C. 95976, Z45.42, G40.909. D. 95970, Z45.42, G40.909. Pre-procedure diagnosis analysis of vagal nerve stimulator, epilepsy with history of seizures. Post-procedure diagnosis, the same. Procedure, but vagal nerve stimulator analysis. Patient here for VNS implant analysis with possible adjustments. The programming head was placed over the implanted neurostimulator located within the patient's neck left side. Impedance was verified, ensuring parameters within normal limits. Parameters charted and flow chart within medical record. Operating status of neurostimulator reflects on estimated time for analysis. Interrogation was 20 minutes in duration. Patient denies questions at this time, would repeat analysis in 3 months. What are the CPT and ICD-10 coders reported? Coders, you have 2 minutes.
That was a pretty long scenario, and I know you might need some more time for this, uh, but time is almost up. So let's walk along, coders. Please keep working on this. And for the time being, I will walk along through this scenario. Let's highlight the keywords. Analysis of vagal nerve stimulator, VNS, epilepsy with history of seizures, vagal nerve stimulator analysis, procedure performed. Patient is here for VNS implant analysis with possible adjustment. And estimated time for the analysis or interrogation was 20 minutes duration. Okay, so before moving on to solve the scenario, let me say what neurostimulator analysis programming is all about. Once again, this is a particular section from the neurostimulator from the medicine, and it would be good if you read through these scenarios, these guidelines and these informations. So in what happens in a neurostimulator analysis and programming is that we will have a physician or a qualified healthcare professional who performs electronic analysis of the system parameters of a previously implanted neurostimulator, pulse generator, or a transmitter to ensure that it is functioning properly. They will be also making some complex programming changes to these system parameters in order to address the clinical signs and symptoms. I know this is too much, so I will just simplify. I'm not sure whether this appropriate example for this scenario, so I will just simplify this for you. It's like an air conditioner which we buy for our home, and we will be having them fitted, and what we will do is that we will do the analysis of this air conditioner initially. We'll try to switch it on and switch it off. That is the analysis portion, the first one which we do. We will see whether it's working properly and all, and then we will make some complex programming changes to it. If it is too hot, we'll reduce the temperature. If it is too cold, we will increase the temperature. So like we will switch on the heaters or something, and that is a complex programming portion. So this has got two things. We will be having a neurostimulator which will be located in various parts of our body, and then first we will do the analysis portion, and then we will do the complex programming, complex or a simple programming, so that it will address the issue. It will serve the purpose for which it is there for. Are you clear, coders, on this? What a neurostimulator analysis and programming? It has two portions. So yes, and what it will also do is that it will measure several parameters, as I said. And these are the parameters. It has got several parameters like contact groups, interleaving, amplitude, pulse width, frequency. There are several parameters that will be adjusted and monitored over the period of time. And another important thing while coding this is to know that there are several types of implantable neurostimulator, pulse generator, or transmitters, and they are differentiated like based on the location which they belong. Like if they are located in the deep brain structures, it is called a deep brain stimulator. If it is located in the surface of the brain, it is called a cortical stimulator. If it is goes to the cranial nerves, then we will call it as a cranial nerve stimulator. So based on this location, we will name them. They are differentiated. So that's all about neurostimulator pulse generator. I'm sorry, neurostimulator analysis and programming. And here you can find how, as I said, how they are classified. These neurostimulator, a pulse generator, or transmitters are classified based on the location which they goes. The code series 95970 is for a neurostimulator, transmitter, or pulse generator which is located in these areas. It is 95970 is coded when the neurostimulator, pulse generator, or transmitter is located in brain, cranial nerve, spinal cord, peripheral nerve, or the sacral nerve. And we have next sets of codes 95971, which is coding for a neurostimulator, pulse generator, or a transmitter when they are located in the spinal cord or peripheral nerve. But this code also involves simple programming. As I said, there is an analysis portion, The 95970 only codes for analysis portion. In 95971, we have an analysis portion as well as a simple programming. And these are for the one which located in the spinal cord or peripheral nerve. Let's look into next one, 95972. This involves electronic analysis along with complex programming of a neurostimulator pulse generator or transmitter when they are located in spinal cord or peripheral nerve. And 95976 is for an electronic analysis with simple programming for an implanted neurostimulator when it is located in cranial nerve. And last one, 95977, it is for a neurostimulator. It involves complex programming as well as analysis when it is located in the cranial nerve. And now you will be having a question, what is a simple programming and what is a complex programming? Well, CPT has gone ahead and also explained what simple programming is. A simple programming of a neurostimulator is when we will have an adjustment of 1 to 3 parameters, just 1 to 3 parameters. As I said, there are several parameters that can be adjusted. If it is just adjusting 1 to 3 parameters, it is a simple programming. And what is a complex programming? Complex programming involves adjustment of more than 3 parameters. So that's all about the guidelines. And that's all about the guidelines. And let's move ahead and solve the scenario. The procedure performed is vagal nerve stimulator analysis. So the neurotransmitter here is located in the vagal nerve. And the diagnosis, we are having analysis of the vagal nerve stimulator, and the patient is also having epilepsy. So as I said, the neurostimulator in our scenario is located in the vagal nerve. Its purpose is to stimulate the vagal nerve, and you must be knowing that vagal nerve belong to one of the 12 cranial nerves. It's the 10th cranial nerve. Well, this particular image, I got it from the CPT itself. It was not taken from any other Google images or something. This is in the CPT book, our CPT book itself. So you can see that it is a 10th cranial nerve. So what we are having is a cranial nerve stimulator in our procedure. And these are the code options. And also here also I have done chunning. The code 95972 is for analysis plus complex programming of a stimulator located in the spinal cord or peripheral nerve. And 95970 is for analysis alone for a neurostimulator which is located in the cranial, spinal, peripheral, or sacral nerve. The code 95971 is for analysis plus simple programming, just simple programming of neurostimulator which is located in the spinal cord or peripheral nerve. And last one, we are having 95976 for analysis plus simple programming of a neurostimulator which is located just in the cranial nerve. And let's look into the first option, option B, 95972. 95972 is coding for analysis plus complex programming for the neurostimulator which is located in the spinal or peripheral nerve. As I said, in our scenario, the neurostimulator is located in the cranial nerve. It is not in the spinal cord, it is not in the peripheral nerve. And we didn't had any complex programming. We just had an analysis only done in our scenario. So there is no complex programming, and the location of the neurostimulator is also incorrect. So that cancel out option B. Let's look into option C. 95976, it is coding for analysis plus simple programming of a cranial nerve. Well, the location in our scenario is correct. It is in the cranial nerve, but we are not having any simple programming. We have just doing the analysis alone. So that will also eliminate option C. And remaining two options, let's look into second last option, 95971. It is coding for analysis plus simple programming of a stimulator which is located in spinal cord and peripheral nerve. Once again, the location of the neurostimulator is wrong, as well as there is a programming performed in this code. We are not having programming, and the location is also wrong. The correct answer finally is option D, 95970. Let's look into that. It is coding only for analysis of a neurostimulator which can be located in cranial, spinal, peripheral sacral nerve. We are having a neurostimulator located in the cranial nerve, this one, and analysis is only performed. That's how we arrived into option D. Yes, this is a little bit hard one. This is a little bit long one. And again, one I have to put emphasis on the churning. See how I churned all these things, and it love this scenario. Yes, I also love this scenario. That's why I didn't want you guys to miss this one. So this churning, it's very time consuming if you go all through these, if you're reading all through these code descriptions. And if I had this churn in this simple manner, I could have easily picked this answer. Like within 1 minute, maybe I could have seen the churning, and I could have cross-checked with the procedure inventory, and I could have arrived in the correct answer just like that. So coders, always remember, churning is life. Please try to do your churn. It will be it will do a lot of help for you during the exams. So I hope you like the scenarios today. I hope you had a good teachable moment today. And well done, coders. That's all we have for today, this session. And I want to remind you all that next week we will be having another awesome session. This is my favorite. And